Right now, there's a number sitting on your wrist or pulsing quietly in your chest that can predict whether you'll develop heart failure in the next decade. And your doctor has probably never once talked to you about it. A massive study out of Sweden followed men from the general population for over 20 years. And what they discovered should have changed the way every doctor in America thinks about heart health. A resting heart rate above 75 beats per minute doubled the risk of early death from cardiovascular disease. Not high blood pressure, not cholesterol. The number of times your heart beats while you're sitting in a chair doing absolutely nothing. And here's the part that should make you furious. This number isn't included in a single major heart risk calculator used by doctors today. Not the Framingham Risk Score, not the ACC/AHA guidelines, not the European Score 2 system. The easiest, cheapest, most accessible vital sign your body produces every single second of every single day, and the entire medical system pretends it doesn't exist. But what your resting heart rate is actually telling you about the future of your heart goes even deeper than that one study. And by the time we're done here, you'll understand exactly what your number means, why it changes with age, and what you can do starting tonight to move it in the right direction. Section 1, the 75 beats per minute threshold. Let me tell you about Gerald. Gerald was 67 years old, retired electrician, sharp mind, good sense of humor. He went to his doctor every 6 months like clockwork. Blood pressure was always checked. Cholesterol was always checked. His doctor was thorough. Gerald trusted him completely. But there was one number that kept creeping up over the years that nobody paid attention to: his resting heart rate. When Gerald was 58, it sat around 68 beats per minute. By 62, it had drifted up to 74. By 66, it was hovering around 82. Nobody flagged it. Nobody mentioned it. It wasn't circled on any chart or highlighted in any report. Then one Tuesday morning, Gerald was walking to his mailbox and felt something he'd never felt before: a heaviness in his chest, like someone had placed a sandbag across his ribs. He couldn't catch his breath. His ankles, he noticed, had been swollen for weeks, but he'd chalked it up to the heat. By the time his wife drove him to the emergency room, the diagnosis was clear: heart failure. His heart muscle had been weakening for years, pumping faster and faster to compensate, like an engine revving higher because it's losing power. That climbing resting heart rate was the warning light on the dashboard. And nobody looked at the dashboard. Gerald's story isn't rare. It's happening in doctors' offices across the country every single day. And the research that explains why is staggering. The Swedish study I mentioned tracked 798 men from the general population starting at age 50. Researchers measured their resting heart rate in 1993 and then again 10 years later in 2003. Then they followed these men for a total of 21 years to see what happened. The findings were published in the journal Open Heart, and they paint a picture most people have never seen. Men with a resting heart rate above 75 beats per minute had roughly double the risk of dying from any cause, double the risk of dying from cardiovascular disease, and double the risk of developing coronary heart disease compared to men whose resting heart rate was 55 or below. But here's what makes this study especially alarming. It wasn't just about where your heart rate sits at one point in time. It was about the direction it's moving. The men whose resting heart rate increased between 1993 and 2003, that decade when they went from their 50s into their 60s, had a 44% higher risk of developing cardiovascular disease than men whose heart rate stayed stable or decreased. Every single additional beat per minute was associated with a 3% higher risk of death from all causes and a 2% higher risk of coronary heart disease. Then there's the larger picture. A meta-analysis that combined data from multiple studies involving nearly 700,000 people across Asia and Europe found the same pattern. For every increase of 10 beats per minute in resting heart rate, cardiovascular death risk went up by 16%, and all-cause death risk went up by 25%. And this was after adjusting for blood pressure, smoking, body weight, cholesterol, diabetes, and physical activity. The Heart Rate Association stood on its own, and in 2024, the American Heart Association published research from the Atherosclerosis Risk in Communities study, which tracked nearly 6,000 participants over 25 years. They identified 4 different heart rate trajectories over time. People whose resting heart rate increased, even modestly, were 65% more likely to develop heart failure and 69% more likely to die from any cause than people whose heart rate gradually declined. The data is overwhelming. And yet, if you walk into your doctor's office tomorrow and ask what your resting heart rate trend means for your future, most of them won't have an answer, which raises an obvious question. Why not? To understand what a rising resting heart rate is actually telling you, you need to understand how the heart's internal pacing system works. Think of your heart like a house with its own electrical wiring. There's a natural pacemaker called the sinoatrial node that sends out electrical signals telling the heart when to beat. In a healthy, well-conditioned heart, this system runs smoothly and efficiently. The heart doesn't need to beat very often because each beat is strong and pumps a good volume of blood. But as you age, several things can start to go wrong with this system. The heart muscle can stiffen. The walls can thicken. The valves may not close as tightly. And when the heart becomes less efficient at pumping blood, it compensates the only way it knows how. It beats faster. Think of it like a water pump that's starting to wear out. If each pump cycle moves less water than it used to, the pump has to cycle more frequently to keep up. That's what a rising resting heart rate is telling you. Your heart is working harder to do the same job. But it's not just about the heart muscle itself. Your autonomic nervous system, the automatic control center that regulates things you don't consciously think about, like digestion, breathing, and heart rate, also changes with age. You have 2 branches. The sympathetic system, which is your gas pedal, speeds things up when you need to react, and the parasympathetic system, which is your brake pedal, slows things down when you're resting. In a healthy cardiovascular system, the brake pedal is dominant at rest. Your heart rate stays low because the parasympathetic system is keeping things calm and efficient. But chronic stress, poor sleep, inactivity, excess weight, and inflammation can all weaken that brake pedal over time. When the brake loses its grip, the gas pedal starts to dominate, even at rest. Your heart rate creeps up, not because something dramatic happened, but because the balance shifted slowly over years in a direction nobody was watching. And this is where it connects to something most people completely miss about heart health. Let me tell you about 2 women. Both are 71 years old. Both go to the same medical practice. Both get their vitals checked every 3 months. The first woman, Dorothy, has a blood pressure of 142/86. Her doctor is concerned. They've added a second medication. They're watching it closely. Every visit, the conversation revolves around getting that blood pressure number down. Dorothy's resting heart rate is 64 beats per minute and has been stable for years. Nobody mentions it. The second woman, Vivian, has a blood pressure of 128/78. Her doctor is pleased. Textbook numbers. But Vivian's resting heart rate has gone from 66 3 years ago to 72 last year to 79 at her most recent visit. Nobody has mentioned this either. In fact, when Vivian asked about it once, her doctor said it was within normal range and moved on. Based on the research, Vivian may actually be at higher risk than Dorothy. Not because her blood pressure is dangerous, but because her heart rate trajectory is. pointing in the wrong direction. That 13 beat per minute increase over 3 years is a signal that something in her cardiovascular system is changing, her heart is working harder, her autonomic balance is shifting, and if nobody intervenes, she could be on the path toward heart failure within a decade. Meanwhile, Dorothy's stable heart rate of 64 suggests her heart is pumping efficiently despite the elevated blood pressure, which her medications are managing. Her cardiovascular system is under stress, yes, but it's holding steady. Same age. Both look fine on paper, but one has a silent alarm going off that nobody is listening to. This is why treating numbers in isolation is so dangerous. You might be wondering how something this well documented can be this thoroughly ignored. The research isn't new. Studies linking resting heart rate to cardiovascular death go back decades. The Framingham Heart Study noted the connection. The Copenhagen Mayo Study confirmed it. Multiple meta-analyses have reinforced it. And yet, a landmark review published in Progress in Cardiovascular Diseases in 2025 pointed out that resting heart rate is not included as a risk factor in the U.S. or European hypertension guidelines. It's not factored into the Framingham risk score. It's not part of the ACC/AHA pooled cohort equations. It's not in the SCORE2 algorithm, despite being, quote, a strong and independent predictor of cardiovascular mortality. It is simply absent from the tools doctors use to assess your risk. Part of the reason is historical. The major risk prediction models were built in an era when the focus was on factors you could treat with medication. High cholesterol, statins, high blood pressure, ACE inhibitors, beta blockers, diuretics, high blood sugar, metformin. These are conditions with clear pharmaceutical solutions and massive clinical trial evidence behind them. Resting heart rate doesn't fit neatly into that model. There's no widely approved drug specifically designed to lower heart rate in healthy people without side effects. Beta blockers lower heart rate, but they also lower blood pressure and have a long list of other effects. They're not prescribed to someone just because their resting heart rate is 80, so the system doesn't know what to do with the information. And when the system doesn't know what to do with information, it tends to ignore it. But here's the thing. Just because there isn't a pill for it doesn't mean there's nothing you can do. In fact, the most powerful ways to lower your resting heart rate are things you can start doing tonight without a prescription, without a specialist, and without spending a single dollar. And that might be the most important part of everything we've covered. First, you need to know your number. If you have a smartwatch, fitness tracker, or even a basic pulse oximeter, check your resting heart rate first thing in the morning before you get out of bed. Do this every day for 2 weeks and write down the number. You're looking for 2 things. What's your average, and which direction is it trending over time? If your resting heart rate is consistently below 65, your cardiovascular system is in a strong position. Between 65 and 75 is reasonable but worth monitoring, especially if it's been climbing. Above 75 warrants a conversation with your doctor, and above 80 at rest, especially if it's been rising over the past few years, is a signal that should not be ignored. Now, the single most effective way to lower your resting heart rate is consistent aerobic exercise. And I don't mean running marathons. Walking briskly for 30 minutes a day, 5 days a week, has been shown in study after study to lower resting heart rate by 5 to 10 beats per minute over the course of a few months. Swimming, cycling, even dancing, anything that gets your heart rate up during the activity will train it to be lower at rest. Think of it like this. Exercise is strength training for your heart. A stronger heart pumps more blood per beat, which means it doesn't need to beat as often. Second, address your sleep. Poor sleep and sleep apnea are strongly associated with elevated resting heart rate. If you snore heavily, wake up tired, or stop breathing during the night, your sympathetic nervous system, that gas pedal, is firing all night long. Your heart never gets to rest. Treating sleep issues can have a dramatic effect on your resting heart rate. Third, manage chronic stress. Prolonged stress keeps your body in fight or flight mode, and fight or flight means elevated heart rate. Deep breathing exercises, even just 5 minutes of slow, controlled breathing before bed, can activate your parasympathetic system and help bring that rate down. Research shows that people who practice slow breathing regularly, about 6 breaths per minute, can lower their resting heart rate measurably within weeks. Fourth, watch your caffeine and alcohol intake. Both can elevate resting heart rate, especially in excess. You don't need to eliminate them, but if your resting heart rate is running high, cutting back and then rechecking your numbers after 2 weeks can tell you a lot about how sensitive your cardiovascular system is to these substances. And fifth, keep a log and bring it to your doctor. If your resting heart rate has been climbing, show them the data. Most doctors won't dismiss a 2-week trend chart sitting in front of them. It gives them something concrete to work with. Ask them directly whether your heart rate trend should affect your treatment plan, and whether an echocardiogram, which is a simple ultrasound of your heart, might be worth doing to check how efficiently your heart is pumping. For decades, the medical world has focused almost entirely on blood pressure, cholesterol, and blood sugar as the big markers of heart health, and those things matter. But sitting quietly underneath all of them is a number so simple that most people never think twice about it. Your resting heart rate. How many times your heart has to beat just to keep you alive while you're doing nothing. The research tells us this number predicts heart failure, cardiovascular death, and all-cause mortality, with a strength that rivals or even exceeds some of the markers we obsess over. It tells us that the direction your heart rate moves over time matters even more than where it sits at any single moment. And it tells us that the most powerful interventions aren't pills. They're the things you do every day, how you move, how you sleep, how you breathe. You now know something that most people walking into a doctor's office tomorrow won't know. You understand what your resting heart rate means, why it changes, and what to do about it. That's not just information, that's a quiet kind of power over your own health that nobody can take from you. This content is for educational and informational purposes only and is not intended as medical advice. Always consult with a qualified healthcare provider before making changes to your health regimen.